Hello and welcome to CS Diagnostics Pharma. In this video about our hygienic tubing system, MultiCSafe for dual piston injectors, we show how easy and safe the installation is. MultiCSafe is available with a hygienic 24-hour approval. A small note in advance, always wear disposable gloves during all procedures and observe the hygiene regulations. First, install 2 new pistons on your dual piston injector. Deflate both pistons by moving the piston feed rods up to the connections. Remove the protective caps from the pistons. The injector is now prepared for the tube system. Remove the MultiCSafe dual piston transfer system, DTS for short, from the packaging. Check that all connections are covered and connections are undamaged. The blue tube connection side is intended for sodium chloride and is equipped with a permanently installed spike connection, including drip chamber. The transparent tube connection side is intended for contrast media and is equipped with a removable spike on a lure lock connection, including drip chamber. This allows you to connect contrast medium via bottles to the spike or connect contrast medium bags to the lure lock connection. Remove the yellow cap from the sodium chloride connector and connect the lure lock connector to the sodium chloride plunger of the injector. Tighten the connection until it is tight, but please do not tighten any further to avoid damaging the connection. Now remove the yellow cap from the contrast medium connection and connect the lure lock connection to the contrast medium plunger. Also, only pull the connection until it is tight to avoid damaging the connection. Now prepare the blue sodium chloride connection. Remove the tube binding and the cover sleeve on the spike. Now insert the spike into the sodium chloride bottle and open the red vent valve. Fill the drip chamber 3/4 full by squeezing the drip chamber twice. Now remove the cover sleeve on the spike of the contrast medium connection. Attach the contrast medium bottle and fill the drip chamber. Alternatively, it is also possible to connect contrast medium bags. To do this, remove the spike by twisting off the flexible lure lock connection. Now you can simply screw the contrast medium bag tightly onto the lure lock connection and fill the drip chamber. Fill the pistons for sodium chloride and contrast medium. Set the filling quantity so that the contents of the bottle are drawn up plus 10 centiliters. This ensures that the sodium chloride and contrast medium are used up completely. Prepare the DoubleCSafe patient tube, PT for short. The tube has a blue and a transparent one-way valve. The blue valve is intended for connection to the DTS, the transparent connection for the intravenous catheter. When connecting the PT to the DTS, it is important to keep the 2 blue one-way valves facing each other. The DTS has an integrated extension tube with built-in drip protection, also known as swabbable, which seals the lure lock connection. Only when the PT is connected to the blue swabbable is it possible to deflate the patient tube. Make sure that the blue-to-blue connection is correct, as the direction of flow of the patient tube only works from the blue to the transparent one-way valve. Now deflate the contrast medium piston up to the epsilon connection. The piston is then completely optimized, filled until there are no more air bubbles in the piston and tube. Deflate now the sodium chloride piston till the patient tube is completely free of air bubbles and sodium chloride flows out of the cap. Tilt the dual piston injector downwards. Your injector is now hygienically set up, safe and ready for use up to 24 hours. To connect a new patient tube after an examination, repeat the procedure where you connect the swabbable to the blue one-way valve of the patient tube. Deflate the patient tube until there are no more air bubbles and sodium chloride drips from the cap. Did you know that there are many configurations for the MultiCSafe transfer system due to the integrated extension tubes? Straight tubes are suitable for short distances. They're available in 39 and 59-inch lengths from the epsilon connection to the swabbable. For longer distances, there are spiral tubes with lengths of 78 and 98 inches. They are particularly suitable for large hygienic challenges, for example, with infectious patients. This allows you to increase the distance and improve hygiene and safety for subsequent patients. For the DoubleCSafe patient tube are also different lengths of 19, 39, and 59 inches available. This prevents the patient's skin from coming into contact with the connection point of the swabable, and the area remains hygienically clean. You can therefore work from 59 to 157 inches in length via the injector, depending on your requirements. We will be happy to advise you on which configuration is the best solution for your daily examination routine and how you can save material, money, and valuable time when using the tube system. Visit our website or contact us directly by phone or email. Thank you for your time and see you soon.